Hey, future PTAs. Hope you're doing well. You guys took neuroanatomy a year and a half ago at this point, and so we're going to do a quick review before we start our neuro rehab. So the major components of the nervous system, you have your central nervous system, which is your brain and spinal cord, the peripheral nervous system, which is all other nerves that go out to the muscles and skin and other areas, nerve cells, neurons, neurotransmitters and synapses, axons, gray matter, and white matter. So we're going to go into a little bit of these things and mostly just hit the highlights. So your brain has protective and supportive structures called meninges. And remember, there's 3 layers. The dura mater is on the outside. It is the strongest layer. The arachnoid is in the middle. And the pia mater is on the inside, and it surrounds the actual brain cells and goes kind of in and out throughout the brain versus the others are more close to the skull. The lobes of the brain, if you remember, there was the frontal, so in the very front of the brain, it helps with movement. The motor cortex, sorry, lost the word for a second, is in the very back of the frontal lobe. It also helps with problem solving, speech, and behavior. So if you remember, this is the last portion of the brain to mature, and it is responsible, it's kind of like your filter. So it's responsible for like higher level thinking and functioning, personality. A lot of those things are in the frontal lobe. The temporal lobe is on the side near the ear. So hearing is there in the temporal lobe, but also language, memory, and emotions are processed in those areas. Then behind the frontal lobe is the parietal lobe. So your intelligence, language centers are also there in the parietal lobe. Your sensation, the sensory areas are there, and your reasoning is also in the parietal lobe. These are just some quick generalizations for each lobe, just to remind you what we learned last semester. So the actually 2 semesters ago, the occipital lobe is primarily vision in the very back of the brain, and then we have the cerebellum, which is the very bottom portion. It's primarily balance and movement, and the brain stem, which is the bottom. It's not a lobe. Those 2 are not lobes of the brain, but it is for your basic functions to keep you alive, like breathing, heart rate, swallowing, things like that. Okay, you have 2 lobes of the brain, hemispheres of the brain, the right and left. The left hemisphere, always think left logic. It's more of your math and science, your sense of time, your language. A lot of that is all on the left side of the brain. Your right is more your creative portions of the brain, nonverbal, artistic, creative, imagination, intuition, all those things are housed more on the right side of the brain. Now, you do have centers for both on both sides, but this is the primary responsibilities when you're differentiating between the right and left hemispheres of the brain. Some of the deep brain structures, so the internal capsule. This is a bundle of nerve fibers, and it receives sensory input from the body and then sends motor output out to the body. Your diencephalon, this picture towards the right is your diencephalon. It has a lot of different parts. Within that, the thalamus, it processes signals from all 5 senses to help you determine pleasant or unpleasant and kind of get your general sense of well-being. Your hypothalamus, it controls the autonomic nerve system. It helps with growth, metabolism, and helps you regulate a lot of your functions like hunger, thirst, sex, body temperature, sleep-wake cycles. A lot of that regulation is all through the hypothalamus. The pituitary gland is controlled by the hypothalamus, and it is what releases your hormones. Then we have the basal ganglia, also called the basal nuclei, and they control voluntary movement, action selection and habit formation. So like when you like motor learning, like riding a bike, something that you can do without thinking about it once you learn it, that is responsible. The basal ganglia is responsible for that type of habit formation. And then the limbic system is your emotional center of the brain. It helps also with memory and with the automatic survival response like fight or flight. Your brain stem is composed of the midbrain, that's kind of the top right above the pons, and then the pons, and then the medulla, which has a little line going to it, but the word is in black and on black, so you can't see it. It controls the brainstem itself controls the vital functions such as sensation, cranial nerves, heart rate, respiratory rate, some of those things. So if the brain stem gets damaged, most of the time, the person cannot live because the vital functions, breathing, heart rate, all stop. The cerebellum is primarily balance and coordination. Here's our anatomy of the spinal cord. So just to kind of orient you to this picture, the vertebral bodies are in the front. This is the bone surrounding the spinal cord. The spinous processes you can see pointing out the back. So the front of the spinal cord is closest to the front of the picture, and the back is closest to the right side of the screen. And the spinal cord is made up of a lot of different spinal tracts. Some of them are afferent. They carry sensory information from the body up to the brain. Others are efferent. They carry motor output from the brain out to the muscles. The internal anatomy of the spinal cord, there is white matter, which is primarily composed of axons. It's white because of those that myelin sheath that surrounds the axons to allow the impulses to jump and move faster throughout the system. And then there is gray matter, which is primarily the cell bodies and the dendrites. So the gray matter is more towards the inside. It looks kind of like the butterfly shape in the middle of the spinal cord. And then the white matter primarily surrounds that. Um, there are several portions of the spinal cord. The dorsal horn, so closest to the back of the spinal cord, is primarily sensory or afferent nerves. So primarily bringing sensation up from the body. The lateral, the side portions of the spinal cord, have a lot of the autonomic nervous system neurons that control that, and then the ventral horn, the most um, anterior portion, is primarily motor neurons. So primarily neurons traveling from the brain down and out to the muscles to allow movement. Peripheral nervous system is the nerves that aren't housed within the brain or spinal cord. So they're the ones that once they exit the spinal cord, they become peripheral nerves. Remember, cranial nerves are also a part of the peripheral nervous system. The somatic nervous system carries sensory input to the brain and motor output from the brain to the muscles. So that is called the somatic nervous system. We have various nerve plexus throughout our body. So a plexus, if you remember, is an interwoven network of nerves. So we have a cervical plexus, a brachial plexus, a lumbosacral plexus, and that's just kind of where a lot of nerves exit to go to different portions of the body, and there is a network there. And of course, we learned those in our neuroanatomy class, but those are important when you're learning about nerve injuries and how they affect a person. Cranial nerves, we'll just go through these quickly. I've simplified their functions, so they do have some of them have more than one function, or like a more specific portion of how they move the eyes or how they which portions of the face they control or things like that. So this is just a simplified version to remind you what each of the cranial nerves do. One is olfactory, and it's primarily related to smell. Two is optic, and it's primarily related to vision. Three, oculomotor, and it's primarily eye movements. Trochlear is also eye movements. Trigeminal is chewing and face sensation. It also gives you sensation to the tongue and mouth. Abducens is also primarily eye movements, mainly lateral. That's like abduction. Facial is primarily your facial expression, but also taste. And the vestibulocochlear is primarily hearing imbalance. Glossopharyngeal has a lot of different functions that seem unrelated. Salivation, heart rate, blood pressure, all related to that glossopharyngeal nerve. The vagus nerve also assists with heart rate, but it also does swallowing, digestion, and some of your vital functions. The spinal accessory nerve, it only is responsible for innervating the sternocleidomastoid and the trapezius. Such a random spinal nerve, I feel like. But that's what it does. It innervates the SCM and the trapezius. And then the hypoglossal is cranial nerve 12, and it is responsible for tongue movements. The autonomic nervous system has your parasympathetic and your sympathetic nervous system. So the parasympathetic brings you back to homeostasis. So whereas the sympathetic is your fight or flight, the parasympathetic is your rest and digest. So with the sympathetic, it increases your heart rate, dilates your pupils, helps with breathing, and decreases the body's focus on digestion at that moment, because that's not as important at that moment. It's your survival instincts. Versus the parasympathetic decreases your heart rate, relaxes or constricts your pupils, narrows your vessels for breathing, and increases digestion. So it helps you come back to your state of rest and recover after an event. Cerebral circulation. So there is anterior and posterior circulation. Parts of the anterior circulation include the carotid arteries, the anterior cerebral artery, and the middle cerebral artery. These are most important when we start talking about stroke, and what blood vessels are affected and how that affects a patient's body due to the blood flow not circulating in that part of the brain, and that part of the brain either being damaged or dying. The posterior circulation include the vertebral arteries and the posterior arteries. One of the things I like to always point out, in the picture, you can see that circle of Willis. That's really key, because if there's a stroke that affects maybe the anterior cerebral artery, or sometimes other arteries in the brain, and the circle of Willis is still intact, it's not affected, then that blood flow oftentimes can go around that circle of Willis and still perfuse or give blood to the other areas, and the patient will have a lot less lasting effects from a stroke or from some type of blood clot in the brain. So we will cover some of this in more depth and go into a lot of the dysfunction and the diagnoses that affect these this anatomical structures we just talked about. So that is all for us for now, and I will see you in the next lecture.